Cancer. It's a word that can strike fear into the hearts of many. The mere mention of it can cause anxiety and stress, as it is often associated with severe illness and uncertainty. The good news is that we have more power over cancer than we think. Through informed choices and proactive measures, we can take control of our health and reduce our risk. We can take steps to significantly reduce our risk. Regular physical activity, a balanced diet rich in fruits and vegetables, and avoiding harmful habits like smoking can make a substantial difference. That's what cancer prevention is all about. It's about understanding the factors that contribute to cancer and taking actionable steps to mitigate those risks. Prevention is always better than cure. By focusing on prevention, we can avoid the physical, emotional, and financial toll that cancer treatment often entails. This holds especially true for cancer, a complex disease often requiring intensive treatment. Early detection and preventive measures can lead to better outcomes and a higher quality of life. By adopting preventive measures, we can significantly reduce the burden of cancer. Community efforts and awareness campaigns play a crucial role in spreading knowledge and encouraging healthy practices. This isn't about living in fear, it's about being informed and proactive. It's about making choices that reflect a commitment to your well-being. It's about taking charge of your health. Attending workshops, staying informed about the latest research, and consulting healthcare professionals can empower you to make the best decisions for your health. It's about making choices that empower you to live a longer, healthier life. Simple changes like incorporating more physical activity into your daily routine and choosing nutritious foods can have a profound impact. In this essay, we'll explore the many ways you can prevent cancer. From lifestyle changes to regular screenings, there are numerous strategies that can help you stay ahead of the disease. You'll see that small changes can make a big difference. By taking these steps, you can reduce your risk and lead a healthier, more fulfilling life. Cancer prevention involves taking proactive steps to reduce your risk of developing cancer. It's about making healthy choices and avoiding known risk factors. Think of it like this. Every healthy choice you make is like adding a layer of protection. These layers add up over time, making a real difference in your overall risk. Cancer prevention is a journey, not a destination. It's a series of choices you make every day to prioritize your health. And remember, it's never too late to start making healthier choices. Our lifestyle plays a crucial role in cancer prevention. This includes our diet, exercise habits, and whether we smoke or drink alcohol. One of the most impactful things you can do is maintain a healthy weight. Excess body weight is linked to an increased risk of several cancers. Regular physical activity is another cornerstone of cancer prevention. We'll delve deeper into the benefits of exercise in the next section. But for now, know that moving your body can significantly reduce your risk. You are what you eat. This age-old saying rings true, especially when it comes to cancer prevention. A healthy diet can significantly reduce your risk. Load up on fruits and vegetables. These colorful powerhouses are packed with antioxidants, vitamins, and minerals that fight cancer-causing damage. Limit processed foods, sugary drinks, and red meat. These foods can increase inflammation in the body, which can contribute to cancer development. Choose lean proteins, whole grains, and healthy fats instead. Section 5. Move your body, reduce your risk, exercise, and cancer. Physical activity is not just about losing weight or building muscles, it's a powerful tool for cancer prevention. Regular exercise boosts your immune system, helping it fight off cancer cells more effectively. It also helps regulate hormone levels, another factor linked to cancer risk. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise each week. Find activities you enjoy and make them a part of your routine. Section 6. The evils of smoking and excessive alcohol. Smoking and excessive alcohol consumption are two of the most significant public health issues today. They not only affect the individual but also have a profound impact on society as a whole. Smoking is a leading cause of several types of cancer, including lung, mouth, and throat cancer. The tar and chemicals in cigarettes coat the lungs, leading to chronic respiratory issues and eventually cancer. The chemicals in cigarettes damage your DNA, increasing the risk of cancer cells developing. This DNA damage is irreversible and can lead to mutations that cause cells to grow uncontrollably. Excessive alcohol consumption is another major risk factor. It can lead to a range of health problems, including liver cirrhosis, which is a severe scarring of the liver tissue that impairs its function. It can damage the liver, increase estrogen levels, and impair the body's ability to break down harmful substances. High estrogen levels can increase the risk of breast cancer in women. Quitting smoking is one of the most important things you can do for your health. The benefits of quitting start almost immediately, with improved lung function and reduced risk of heart disease. If you drink alcohol, do so in moderation. Moderation is key to minimizing the risks associated with alcohol consumption. For women, this means no more than 1 drink per day. This limit helps reduce the risk of developing alcohol-related health issues. For men, it's no more than 2. Sticking to these guidelines can help maintain a healthier lifestyle and reduce the risk of alcohol-related diseases. The economic impact of smoking and excessive alcohol consumption is staggering. Healthcare costs, lost productivity, and other related expenses amount to billions of dollars each year. Community programs and support groups can be incredibly effective in helping individuals quit smoking and reduce alcohol consumption. These programs provide the necessary resources and support to make lasting changes. Support from family and friends is also crucial. Encouragement and understanding from loved ones can make a significant difference in the journey to quit smoking or reduce alcohol intake. Adopting a healthy lifestyle, including regular exercise and a balanced diet, can further enhance the benefits of quitting smoking and moderating alcohol consumption. These changes can lead to a longer, healthier life. Consulting with healthcare professionals can provide personalized advice and strategies for quitting smoking and reducing alcohol intake. Medical guidance can be invaluable in making these significant lifestyle changes. In summary, the evils of smoking and excessive alcohol consumption are clear. However, with the right support and determination, it is possible to overcome these challenges and lead a healthier, more fulfilling life. Section 7. Shielding yourself from the sun. The sun's ultraviolet UV rays are a major risk factor for skin cancer, the most common type of cancer in the United States. Overexposure to UV rays damages skin cells, increasing the risk of cancer. Protecting yourself from the sun is crucial. Wear protective clothing such as wide-brimmed hats, sunglasses, and long sleeves when you're outdoors. Use a broad-spectrum sunscreen with an SPF of 30 or higher, even on cloudy days. Avoid tanning beds which emit harmful UV rays. Section 8. Vaccinations, a shield against certain cancers. Believe it or not, vaccines can help prevent certain types of cancer. This might come as a surprise to many, but the role of vaccines in cancer prevention is both fascinating and crucial. The human papillomavirus, or HPV vaccine, protects against HPV infection, a common sexually transmitted infection that can cause several types of cancer, including cervical cancer. HPV is responsible for nearly all cases of cervical cancer, and the vaccine can significantly reduce the risk of developing this disease. The hepatitis B vaccine protects against hepatitis B infection, which can lead to liver cancer. Chronic hepatitis B infection is a major risk factor for liver cancer, and vaccination can help prevent this serious condition. Talk to your doctor about whether these vaccines are right for you. It's important to have a conversation with your healthcare provider to understand the benefits and any potential risks associated with these vaccines. Vaccines are a powerful tool for cancer prevention. They not only protect individuals but also contribute to the overall health of the community by reducing the spread of cancer-causing infections. They work by training your immune system to recognize and fight off specific viruses that can cause cancer. When vaccinated, your body is better prepared to defend itself against these harmful infections, reducing the likelihood of cancer development. By staying informed and proactive about vaccinations, you can take a significant step towards safeguarding your health and the health of those around you. Section 9. Early detection is key, the importance of screenings. Cancer screenings are tests that check for cancer before any symptoms appear. Early detection is crucial because it increases the chances of successful treatment. There are many different types of cancer screenings, each recommended for specific age groups and risk factors. Talk to your doctor about which screenings are right for you. Screenings can detect cancer in its early stages when it's most treatable. Don't delay, schedule your screenings today. Section 10. Genetics and family history. Understanding your risks. While lifestyle choices play a significant role, genetics also contributes to cancer risk. A family history of cancer can increase your chances of developing the disease. Knowing your family's medical history can help you make informed decisions about your health. Talk to your doctor about your family history and whether genetic testing is appropriate for you. Understanding your genetic predisposition can empower you to take proactive steps to reduce your risk or detect cancer early. Section 11. Your health, your future, taking charge. Cancer prevention is a lifelong journey. It's about making conscious choices every day that prioritize your health and well-being. While we can't eliminate the risk of cancer entirely, we can significantly reduce it. Remember, knowledge is power. By understanding the risk factors and adopting preventive measures, you can take charge of your health and create a brighter future for yourself and your loved ones. Every step you take towards a healthier lifestyle counts. Make the commitment to prioritize your health today. Your future self will thank you.